In rural countrysides across America, an aging population has a growing problem: access to health care. In Danville, Pennsylvania, a borough of roughly 4,600, people travel more than an hour to get to the hospital. The town's flagship medical center, with a workforce population greater than all of Danville, says it needs non-native workers to keep its optimal nurse-to-patient levels. And the shortage is expected to get even worse.
Like many hospitals across the country, Geisinger is faced with an aging community population and, quite frankly, an aging workforce. And so we have to look at our workforce of the future and what that might look like.
So the hospital is turning to international registered nurses like Jamaica native Hemoy Drummond.
It's not easy to move with two girls away from family. Usually you're moving closer to family, but I took the chance.
Nationwide, nearly 15% of nurses and 23% of health aides are immigrants, according to research by New American Economy. Geisinger touts professional growth opportunities to attract international talent.
A long-term goal would be to get my certification in neuroscience and probably in the longer run be a nurse manager.
But with more than 1.3 million healthcare job openings expected over the next decade, hospitals need more help. The workforce gap is growing across the sector, from home health aides to specialized physicians, and especially in rural areas.
If you look at urban areas, something like there are 200 doctors or over 200 doctors per 100,000 people. But if you look at rural counties, the coverage or the number of doctors to go around is much less, something like 82 for every 100,000.
On May 16, President Trump announced a new merit-based immigration plan, but it is unclear whether this would help the shortage of medical professionals if it ever became law. Like Geisinger, Chambersburg Hospital is relying on non-native workers. Roughly half its medicine physicians are foreign graduates.
When we interviewed, we didn't find sufficient American graduate, but somehow they don't like small town or something like that. So if we interview like 10 American graduate, maybe one show up.
Kurdistan, northern Iraq, Pakistan.
VOA spoke with 10 foreign-born doctors in Chambersburg. 9 expressed a willingness to stay.
I love my patients. I love what I'm doing in Chambersburg. Right? And most physicians, once they start off at a particular place and they form bonds with their own patients, it's tough for them to move to another area.
Indian physicians like Dr. Tirupathy face a long wait for permanent residency due to a green card backlog. Tirupathy says he hopes his commitment to the town will not be taken for granted. Ramon Taylor, VOA News, Danville, Pennsylvania.